We are in the middle of an emergency blood shortage across the United States, state of Idaho, and in the Treasure Valley. It's one of the reasons crisis standards of care has been declared across the southern part of the state. It's why organizations like the Red Cross are calling on any and all to donate blood. Well, not exactly all. Because did you know that gay and bisexual men are not allowed to donate blood in certain circumstances? The FDA rules clearly state men who have had sexual contact with another male in the past 3 months cannot give blood. Seems at odds with the emergency we're facing right now and at odds with scientific knowledge. It's a policy rooted in the HIV/AIDS epidemic dating back to the 1980s. Critics point out a lot has changed since then, especially with advances in technology. So now LGBTQ advocates are advocating for the policy to change because, well, they want to be part of the blood shortage solution. Here's Joe Paris.
Amid a national and local blood supply crisis, advocates are speaking out on an FDA policy that bans gay and bisexual men from donating blood if they've had sexual contact with another male in the last 3 months.
It's time to move past that. This is a ban that's been in place for decades. It's harmful, it's hurtful. It's excluding millions of people from being able to donate blood.
Joseph Kibbe is the vice president of the Boise Pride Festival. As a gay man, Kibbe says it's very frustrating that people like him can't donate blood, especially during a crisis.
For me, it's personally shameful to opt out of blood drives and explain to coworkers and other people that I can't donate blood based on just being a member of the LGBTQ plus community. So it's time to be done. It's just antiquated.
Blood donation restrictions on gay and bisexual men date back to the HIV/AIDS epidemic in the 1980s. At the time, the federal government created a lifetime ban on blood donations policy for men who have had sex with men. In 2015, the ban was altered to allow gay men to donate blood, but only if they'd abstained from sexual contact for a full year. In 2020, that was changed to a 3-month waiting period.
Honestly, I haven't donated blood since I came out a number of decades ago, and only in compliance with that federal requirement. And I certainly would if I could.
Garden City lawmaker John McCrostie says he has found that people are surprised to find out that the FDA rule heavily limiting blood donations from gay men is still active policy.
There are a lot of organizations that I've been involved with in the last number of years who, once you bring that up, they have that exact same experience. And they say, no, that's an antiquated rule that doesn't exist any longer. Yeah, it still happens today.
On their website, the FDA acknowledges that all blood donations are tested to make sure there isn't anything harmful in the blood that would make it a dangerous transfusion. Advocates question why there's only a ban on gay and bisexual men if we have the technology to detect issues. If there is an issue with any blood, it can be tossed, no matter who donated it. LGBTQ advocates point out it's a harmful stereotype that only gay men can contract HIV or AIDS to the point that it would compromise blood transfusions. The American Red Cross continues to push for policy changes that would allow men who have sexual contact with men to join the blood donation pool. They write, quote, "The Red Cross believes blood donation eligibility should not be determined by methods that are based upon sexual orientation and is committed to working with partners towards achieving the goal." The ACLU of Idaho agrees, especially during a blood crisis. They wrote to me in a statement, quote, "We do not believe that the FDA's current blanket 3-month ban policy is based in science because it does not engage in an individual risk assessment of potential donors. Eligibility for donating blood should be based on evidence backed by science and not harmful and outdated stereotypes."
I go to my doctor on a regular basis. I keep myself healthy and I'm willing to help, but I can't. And it feels like your hands are tied. And it's just time to change that policy.
Advocates tell me they just want to help their community by donating blood and to be treated fairly.
I would do my best to be one of the first people in line. And if I have to wait at the back line, I'm happy to do that too.
For literally lack of a better term, was to roll up our sleeves and get it done. And it's time.
And we've been talking in our newsroom over the last few weeks. There really are a lot of people that are unaware about this policy, and there actually was some renewed attention on it in early 2020. During COVID, as it was really getting going, there was concerns if for some reason we get into a medical emergency, will we have enough blood? And there was talk then in early 2020 about changing this rule. But Brian, as we come into now in 2022, there still has been no real movement on that in the sense of fully removing it, as we've talked about in this story. But the FDA is continuing to look at it, and supporters of really being critical and taking a close eye at this say that they want to just have more research done. Meanwhile, though, others in the medical community say there's been plenty of research done and we have the technology to do this safely.
We were talking about this policy of time. I didn't realize it was that recently, 2020, that they kind of pushed it up to that 3-month period, which still seems kind of, well, antiquated based on science. But you would think that there's a blood test or some sort of testing we could do to kind of put all this to the side and not have to worry about it anymore.
And there's a lot of testing you could do before blood test, or excuse me, before donating blood and after, Brian. So that's really what supporters are saying here, is that we have the technology to deal with this.
All right, just a matter of the higher ups getting on board, I guess, and following through. All right, thank you very much, Joe.